Hi, my name is Chelsea Yano, and I'll be presenting the argument for the compensation of organ donation. My group members are Peyton Doyle and Amy Undercover. So organ transplants began in 1954 when the first kidney was transplanted. Since then, we've come a long way and are successfully transplanting multiple different organs due to the advancements in prevention and treatment of rejection. Over 617,000 transplants have occurred in the United States since 1988. Living donors can donate kidneys, intestines, blood, bone marrow, and parts of their liver. What organs donated after death include liver, kidneys, lungs, pancreas, small intestines, tissues, heart valves, and more. These deceased donors can save up to 8 lives with their donation. As of September 29, 2015, 122,500 individuals in the U.S. are on the organ transplant waiting list. On average, 79 individuals are added to this list every day, and about 22 people will die daily waiting. There's just not enough organs for as many people that need them. In 1984, Congress passed the National Organ Transplant Act, or NOTA, as I will be referring to it as. This act prohibits the buying or paying for organs. However, it does not ban compensation for things like transportation, lost wages, child care, medical bills, or even funeral costs. However, we're still not practicing this and giving any compensation. But if this will increase donors and save lives, why aren't we doing it? Well, this problem is obviously significant because of the lives that we're losing. Over 8,000 people are dying every year due to the unavailability of organs. So if individuals or their families were compensated for their expenses, this could increase those willing to donate, again, saving more lives. And we're not talking about just buying the organs. We just want to offer some sort of compensation for their time and effort. And not only could we save the lives of the ill, it could potentially save the lives of illegal donors. As we all know, there's a black market where people are selling and receiving organs illegally. When this is done, it's usually done unsafely with unsanitary conditions and in non-medical facilities with unskilled surgeons. This puts the donor and the recipient both at risk for serious health problems, such as infection, sepsis, and even death. Now, kidneys are the most needed organs for transplant, with 10% of these transplants are worldwide involve these illegal organs. So if we could find a way to increase the legal organs available, we may decrease the number of illegal trafficking, which again, we're saving more lives. So what does this matter to us as nurses? Well, we as nurses are responsible under the American Nurses Association Code of Ethics, where we commit to our patients and our community. Our first and foremost responsibility is to do no harm to our patients. So what does saving lives fall under this? In Provision 8.1, it refers to health needs and concerns. It states the nurse has the responsibility to be aware not only of specific health needs of individual patients, but also of broader health concerns such as world hunger, environmental pollution, lack of access to health care, violation of human rights, and inequitable distribution of nursing and healthcare resources. So we feel this is a broader health concern as effects are worldwide, and we as nurses need to band together to help make organ compensation a possible solution. Also, by denying recipients possible organs, we're violating the equitable distribution of healthcare resources. Under Provision 8.2 of the Code of Ethics, it discusses the responsibility of a nurse has to the public. It states the nurse supports initiative efforts to promote health such as poverty, homelessness, unsafe conditions, abuse, and violence, and lack of access to healthcare. If we have an opportunity to increase lives by compensating donors, but we aren't, wouldn't this be an initiative effort to promote health? If we decrease the organ black market, wouldn't this help eliminate unsafe conditions? Finally, under Provision 9.4, it talks about social reform. We again need to work together to take this to Congress. Us nurses need to change the way the government feels about this issue. We're not trying to pay for organs, we're simply offering compensation for donors with gas, lost wages, funeral, or medical costs. We aren't paying donors, we're simply making it possible to give a gift they may not have been able to give. So what other efforts have been done to solve the problem? Well, here in the United States, living donors are not able to receive compensation for donating an organ, but some effort has been made to compensate deceased organ donors' families. In 1983, the government of Pennsylvania signed a law to pay for deceased organ donors' families in a bereavement package up to $3,000 that could be used for funeral expenses. However, the program was never initiated due to a fear that it violated NOTA, but in NOTA it states it shall be unlawful for any person to knowingly acquire, receive, or otherwise transfer any human organ for valuable consideration for use in human transplantation if the transfer affects interstate commerce. It does, however, allow for reasonable payment associated with removal, transportation, implantation, processing, preservation, quality control, and storage of human organ, or the expense of travel, housing, and lost wages incurred by the donor of a human organ in the connection with the donation of the organ. As of right now, Pennsylvania does currently offer just $300 to a donor or their family for lodging or food costs through the expense benefit plan for organ donations in their family, which is not really close to that $3,000 that was proposed. However, in other countries like Iran, there have been successful systems implemented in which living organ donors are compensated. During the 1980s, Iran had an international market in place without regulations. So if you could find someone that would give you a kidney, and you could find a physician or surgeon to do the operation, you could have it done. So if you had the money, it would happen. But during the 1980s and 90s, the Iranian Ministry of Health reconstructed the entire process. Then the Iranian Patients' Kidney Foundations took on the responsibility to pair donors and recipients, construct contracts, and follow through the whole process. The Iranian model of kidney transplantation compensates donors, but it's very heavily regulated. After being matched, the donor and the recipient come to an agreement on the amount of money that's going to be paid to the donor for the kidney. And then once it's settled and all the legal documentation is completed, the transplant can only be done at a university hospital under the supervision of the Ministry of Health and Medical Education. And then once the operation is completed, the Charity Foundation for Special Diseases will pay the donor a lump sum and provide free health insurance for 1 year. However, the system is only available for Iranian citizens. The country's wait list for kidney has been eliminated since 1999. And with a higher supply than demand, the price stays pretty low. There's more people willing to donate than actually need the kidney. But there are charities that will help those who cannot afford it. But actually, there's both rich and poor people that receive transplants. And according to a study conducted by Gods and Savage in 2005, 50.4% of recipients were poor, 36.2% were middle class, and 13.4% were rich. So, however, there's a drawback in the system in that it relies heavily on poor people for the donations, as they're more willing to donate a kidney for money. However, this system does also cut out corruption and the black market for organs in the country because of the high level of regulation and affordability of the organ and the transplant. In this entire problem, who are the stakeholders? Well, there's many stakeholders involved in the issue. Firstly, the recipients would be stakeholders since their lives are the ones that we're trying to save. Also, the recipients' families would also be included since they could have another day and time with their loved one. Secondly, the donors and their families are stakeholders. If it wasn't for the extraordinary gift, life wouldn't be possible. And this can sometimes be a very hard decision for patients or families to make. And this is a gift that they didn't have to give, so they should be compensated in some way for their time and money spent. And recipients and donors would be stakeholders together in terms of a black market. Because without more organs, this will continue increasing the likelihood of unnecessary illness and death. And us as healthcare providers, we would be considered stakeholders because under the Code of Ethics, us nurses have the responsibility to protect the public, and we're responsible for doing no harm to our patients. So why would we not want to help them get better? And finally, society as a whole would be a stakeholder in this problem because individuals that normally could not afford transportation or take off work now might have a better opportunity to help a fellow citizen. They could potentially decrease illegal black market for organs, making society a safer place to live in and receive proper health care. So every day men donate sperm and women can donate eggs. Women will carry pregnancies for others, and they're all compensated monetarily. Donating sperm, eggs, and becoming a surrogate only improve the quality of life for those who want children. They don't necessarily save lives. So if we can save lives in a system, why are we getting that pushed back? So we came up with a solution for the United States. We could possibly implement a similar system to Iran's, which would involve the heavy government regulation and providing free medical care for a fixed amount of time. Donors and recipients would have to be matched, and compensation could be arranged between the two parties if they decided to do it in terms of money, because that system has been fairly successful for Iran. But we did come up with a couple other ideas that we could use if we were hesitant to do direct monetary compensation because of the blurred lines of the NOTA. So a psychiatrist and resident scholar at the American Enterprise Institute, who actually did receive a kidney in 2006, her name is Sally Satel, argued that during a debate that one mean of compensation could be giving money to a retirement account. She gave the number of $40,000, but it could be whatever is agreed upon with the donor or the recipient, or any kind of monetary sum that would be agreed upon. It could go into a retirement fund and be used later on. Also, we could provide the donor with health insurance during the donor process and possibly afterwards. Like Iran only provides for 1 year, we could possibly provide health care for longer. As we know, our donors will need health care longer than 1 year after the donation is given, so we could possibly use Medicaid or have another system in place from the government to provide lifelong health insurance, which would over time be quite a large amount of money saved by the donor. Also, the donor could have a lifelong tax credit as a means of compensation, or have a large tax deduction done for 1 year. We can write off charity donations now in our taxes. So if you donate an organ, we could possibly just use that as a large tax deduction there. Another option we came up with was that we could have the donor would receive some kind of scholarship money or college education paid for, either for themselves or maybe possibly for their children, or any family member if the donor was deceased. And if any of these solutions were initiated, we would need to measure if they were successful. So first of all, I think the most obvious would be to watch the organ transplant waiting list. And if the numbers are dropping on that waiting list, then the system would be fairly successful. And if they continue to drop or the entire list would be eliminated, then that would be a successful system. Secondly, if the number of deaths secondary to botched organ removals for the black market are decreasing, success could be happening. And we could, depending on what type of nonprofit organization was created to regulate the compensation, monitoring their methods and results would also show success or not. Because if education was done and more people were signing up to donate organs, either living or deceased, and more lives are being saved, then it would be hard for anyone to argue that it's not successful. And another view we thought about success in the system would be doing a cost analysis to figure out the money saved on dialysis. Even after the cost of necessary immunosuppressive medications and the transplant operation cost, less money by each patient would be spent compared to dialysis, which they have to get done multiple times a week. So there would be a lot of money saved. So we would need the transplant list decreased or eliminated, some money saved, and less black market transplants done. So something needs to be done for our country because people are dying every day just waiting.